Selamat sore semua. My bahasa Indonesia is very bad, so if you excuse me, I will continue in English. So just to give you a brief idea, our program has been working in the past 3 years with Unicef Indonesia in Kabupaten Kupang, in all 24 sub-districts in Kupang district on Timor Island, which is in the eastern region of Indonesia. And I just want to note now that we are fully supported by MFAT New Zealand funds, so thank you. We work in all 100 POUD in all 24 sub-districts. And it's important to remember that number 24, because we also have developed a mentoring program that includes 24 mentors, 1 per sub-district. And we focus on 5 main areas: teacher training and developing this mentoring system that hopefully can be a model for the government of Indonesia in the future. Child-safe buildings and the learning environment. Developing an organizational assessment tool to encourage the POUD to do their own self-assessment to then help them go about planning for change. Developing community engagement in service planning and management. And that also includes parenting, and I'll be discussing more about that later. And then helping district-level government take those national-level policies and regulations and actually implement them at local level. Just to give a brief overview, when we say POUD HI, POUD is the Bahasa Indonesia acronym for ECD, Early Childhood Development, Early Childhood Education. HI is holistic and integrative. So it's not just looking at the education component, even though the Ministry of Education is typically the ministry in the government that takes the lead. It's about the coordination and collaboration. So UNICEF has this Eat, Play, Love campaign, where eating is nutrition and health, feeding your body good nutrition, play is early learning, and love is responsive caregiving and parenting and safety and security. That links directly to the Nurturing Care Framework. The Nurturing Care Framework was launched last year. And it was actually developed by a multitude of international stakeholders, including UNICEF, World Bank, World Health Organization, the Partnership for Maternal, Newborn, and Child Health, and others. And the Nurturing Care Framework is a way to organize policy that incorporates the 5 main areas of holistic integration. You see the very same areas that are in UNICEF's Eat, Play, Love. You have nutrition, health, early learning, security and safety, and responsive caregiving. If we have a POUD program that only looks at early learning, we're missing pieces of the puzzle. So how can we make it work? So the first goal of our program is the training and mentoring. The reason why we focused on this is if you look at Kupang district, they have over 1,000 POUD teachers with only a budget of training 50 teachers a year. It will take them over 10 years to provide the minimum 1 week training, not even thinking about the changes of staffing, people leaving, new teachers coming in, those teachers who then may not get training. So how can we put that need for training into meeting the local needs? They had very poor quality in service delivery. This may be similar in other POUDs where you had the one village, one POUD. All of a sudden, every village opened up a POUD. But not every manager knew what they were doing. Not every village knew or understood what POUD or ECD was. Another fact, in Kupang district, they only had 7 ECE supervisors for over 500 POUDs in all 24 sub-districts. Now, if you look at the local needs, at each district, we heard earlier from our colleague in the Ministry of Teacher and Personnel. There's an issue in limitations of staffing. Do we have staff to play that ECE supervisor role that actually goes out to the POUDs and provides support and training? So one of the main components of our program was to develop this mentoring system. We're the first ECD program in Kupang district that has reached all 24 sub-districts. And I think that's key when we're looking at how to pilot or how to take things to scale. Rather than identifying certain sub-districts to do activities, focus on one district and fully cover all. Because even if you're not working with all the POUD in the district, you're still reaching every chamat. You're still reaching every sub-district level person who can continue the advocacy and the support in the POUD programs that you yourself may not be working in. Our mentors visit POUD at least 4 times a month. They are not classroom teachers. The mentors are hired to do the mentoring. They are the ones that go and observe teachers and give feedback. They are the ones that do training and lead the monthly cluster meetings with the teachers. They are the ones that provide additional support. Because if you have really good teachers, you want to keep them in the classroom to benefit the children and so that they can provide an environment for other teachers to come and observe and learn from. If you take that really strong teacher out of the classroom, you may have to go and train a whole new batch of teachers. We've also strengthened our coordination with other social services in the district. Another thing our mentors do is they have helped develop PTA meetings, Parent-Teacher Association meetings, similar to what we heard in the presentation from Malaysia. Through the PTA meetings, once we established that, that is where we started adding parenting topics. So some data. This data is now from our midline, which was the end of last year. We're just beginning our process of our endline study, so we will have more data by the end of March or April next year. But within a year, children's books went from 53 to almost 83%. POUDs meeting national accreditation, we only had 2 POUD when we started. After a year, we had 17 POUD. And we know by the end of 2019 that number will increase more. I just don't know what that number will be, but I believe we had over 40 apply for accreditation. We provide extensive training, but most of the training is geared to the cluster head teachers and the mentors themselves, who then help train the teachers in the cluster meetings. Our mentoring system also focused on the improvement of the learning environment. Safe drinking water. We heard how that was such an issue of diarrhea and the importance for nutrition. We went from 19% to 57% at the end of last year. Hand washing went from 33 to 87%. Is not a strong improvement from 7 to 9.7, but I think that is similar to Indonesia as a whole. And I think supporting children with special needs is something that, as a whole, from national down to local, we can explore how to support those children more. Toilets, 86 to almost 93%. Having a trash can, 63 to 88%. Another area of how we supported the policy to implementation was looking at how we implemented the national standards. The national standards only have 8. And the way that they were being interpreted at local level, excuse me, was very much output. It was very much, I need to do this as a checklist. I need to just write this on a paper to get it done, you know? So instead, we looked at the process of writing standards, and we looked at them from a holistic, integrative way. Instead of looking at teacher and personnel and monitoring separate, we put that under the standard of management. What are management standards? And those include monitoring teacher personnel, budget, facilities. We added in a standard for Parent-Teacher Association and added the parenting topics under that PTA. So that became a standard, an expectation that all POUD would do this. We looked at the whole process of POUD implementation. So not only content and process, but how do you use the STPPA, the child development outcomes? Content, what does that mean? Before children arrive, during, after children leave. So we looked at it holistically. Health and safety, we added that standard. We added a standard on child protection. We added a standard for disaster planning, and we added a standard for parent communication. We also added 2 additional standards that were specific for Kupang, around 12 characteristics that were identified as priorities by the governor and by the mayor of Kupang district, and what we call 3K, Garden, Canteen, Cooperative, or Kabun Canteen Kooperasi, 3K. And that, and that is how we really address the nutrition aspect for POUD and how we get the parents involved. At the beginning, not one POUD had done a self-assessment. By the end of last year, all 100 had done that. And the self-assessment then helped the POUDs plan for how they would use the block grants that we provided through our program. But this could be a lesson learned for ministry of encouraging POUD to do a self-assessment before they write their proposal for their yearly BOP, so that they have a plan based on their self-assessment on how they want to use the funds that they will receive. At baseline, we only had 40% who had standards. We now have all 100. And key support in that were the mentors, because they worked with the POUDs, teachers and managers to develop them. Now we get to parenting. I mentioned we have the PTA, Parent-Teacher Association. The process that we did, we know that there's so many different parenting curriculums and parenting topics in Indonesia. There was no reason for our program to rewrite something, no reason for us to recreate something. It was important for us to identify how to use what has already been accepted by ministry and how to use it effectively to meet local needs. So in Kupang, we have the Kupang District Government POUD-HI Task Force, which includes all local stakeholders, includes district government, education, health, child protection, community service, etc., all of those government stakeholders. And an earlier consultancy in Unicef did a study. The consultant's name was Susan Graham. She did a study across all the parenting programs in Indonesia and identified what are the key messages across all of them. And so we took that list for 0 to 3, 3 to 6, in all the key areas, and we took that whole list to our Kupang task force, POUD-HI task force, and said, which are the 3 to 5 key messages that speak to you that meet your local needs? So the task force of all these different local government offices came to consensus and identified what they were. So now, within the monthly PTA meeting, we have this routine for about an hour and a half where we try to model a typical POUD session The parents come and have a welcome circle. They share, they may reflect on last month's topic or discuss something that may be pressing. Then the head teacher or the manager or the mentor, if they're assisting, will introduce that month's parenting topic and the key messages. If there's a local resource person from that area of specialty, they will be invited and they will come and share information. If they don't come, because the reality is, out in the field, you invite people and they may not come from Posyandu, if it's not Posyandu Day, etc., then the teacher or manager know how to deliver it themselves. And then we have a game or an activity that reinforces the key messages. So that is how we fit in the parenting topic within our monthly PTA meeting. We discussed having a POUD garden. At the beginning, only 29 POUD had a garden. Now we have 76 had a garden at the end of last year. Only 16% were having their monthly PTA meetings. Now 86% do. And again, we'll find out at the final end line if those numbers have improved further. But look at the changes in behavior. Only 16% of parents said that their POUD does a PTA meeting monthly. At midline, we had 85% reporting that they do. 25% of parents helped with the school garden. At midline, 85% helped, actively helping with their garden, which then helped to the garden produce for supplementary food for the children to eat for their nutrition. At baseline, 70% of parents admitted that they slapped or screamed at their children. By midline, that number dropped to 50%. Now, 50%, that's still too high. We're hoping that now, a year later, that has dropped further. Getting to district regulations and resources. The only way that we will see change from national policy to local implementation is to ensure that POUD Ha'i and 1 year of, when I say PPE, that's pre-primary education, so ages 5 to 6, they must be reflected in the district PERDA, the education law. There must be a Bupati decree and a district regulation. Otherwise, it will be talk, but no budget allocation at local level. So for national, if you can support or track the number of districts that have these in place, then that can also support provincial. We found that to be exceptionally useful in Kupang, to get people together, talking about the issues, identifying gaps. We now have the agriculture office donating seeds to the POUD for their gardens. That would not have happened if it wasn't discussed in the task force. We also worked closely with the ECE directorate to take the 10-module national curriculum and developed it in a way so that it was Kupang friendly and met Kupang or local needs, but is very easily adaptable for any district or any province. All they need to do is change certain cultural references and pictures, but the content of the curriculum is the same. I mentioned our 3K garden canteen in Koperasi. We also had a meeting with the head of villages, and we created a brochure that actually gave them a menu of what are budget line items that they can add to their Dana Desa to support POUD. What is one-time cost and what is reoccurring yearly cost. And in 2019, 78% of our POUD was receiving some support from Dana Desa. Now, here's another lesson learned that may be an issue back up to national level. We're finding that there are POUD that are within churches or mosques or private foundations that village funds do not want to support the building. And I think that brings up the question that was mentioned during the first panel discussion. How can those faith-based or foundation-based POUD maybe access village funds? That gets to an issue of who owns the land that the building is on, who owns the building. I think that could be a discussion at national level to help local districts figure out how to maneuver. When we're thinking about access, we're thinking about monitoring for quality. We need to think about the reality of how you reach and get to a POUD. One aspect of our mentor system, districts can adopt how we took our curriculum approach. They can adopt our mentoring system. But one thing I want to highlight and urge Indonesia as it moves forward is that one-year pre-primary education should complement POUD. It should never compete with POUD over resources, whether staffing, whether budget, whether anything else. If you strengthen that one-year pre-primary, you strengthen POUD overall.